Liver cancers used to be a rare type of cancer in the past, but recently there's liver cancer. The incidence of liver cancer is on the rise in the last few decades. When we talk of liver cancer usually include various types of tumors, but among them the most common type which we encounter is called hepatocellular carcinoma. There are also other types of tumors which we find, but they are less common. This particular type of tumor is on the rise in the recent years because of the increase in the risk factor for developing hepatocellular carcinoma. The most important risk factor for development of liver cancer is cirrhosis of liver, wherein the liver is damaged because of various reasons like alcohol or hepatitis or fatty liver or other toxins, and it goes into irreversible end stage damage. And these are the livers which are at a high risk of developing hepatocellular carcinoma. How do we diagnose hepatocellular carcinoma? When there is a patient who has got a risk factor for developing this tumor, namely a patient with cirrhosis of liver, we subject the patient to regular CT scan screening to see if a cancer is developing in that. If there is a doubt on CT scan, an MRI scan can further confirm the presence of a cancer. How do we treat liver cancer? The treatment of liver cancer depends upon two major things. One, what is the stage of the cancer, and two, what is the nature of the liver. If a patient with a healthy liver develops a liver cancer, majority of them can be treated by removing that part of the liver which is harboring the cancer, where we call a hepatectomy. On the other hand, if there is a patient who has got an existing liver damage, who is a patient with cirrhosis, and he develops a cancer, many of them may not tolerate an operation to remove a part of the liver because the liver is already damaged. If you remove a part of the liver, the remaining liver may not be sufficient to support. In such cases, the only resort is to go for a liver transplant where both the diseases are treated, namely the damaged liver also is replaced with a new one. At the same time, the cancer also is removed from the body. But there are a certain group of patients where the cancer has progressed to an advanced stage and it may not be ready for surgery upfront. In such patients, angiographic methods of treatment are available, wherein through selective canalization of the blood vessels supplying the tumor, a chemotherapy or a radiotherapy agent is injected into the tumor and the tumor is destroyed.